Good morning. This is Dr. Thomas Bartell, board certified plastic surgeon specializing in body recontouring surgery. And the topic for today's little Facebook Live talk is why and why not. First off is why and why not do you have cosmetic body recontouring? Well, it's pretty simple. Why? You do it for you. You don't do it for anyone else. You do it to make you feel better about yourself. That's the most important reason you do body recontouring. Why do you not do it? Well, it's also easy. You don't do it for anyone else. You certainly don't do it for your spouse or your boyfriend or anyone else who says, I love you, but I wish you'd look a little different, or I wish this was different about you, and that kind of thing. That's not a good reason to undergo surgery. You don't do it for any type of secondary gain. You think you're going to get a advancement in your employment. You want to try to attract attention from some suitor or potential suitor. You don't do it for really any other reason that's outside of what's inside of you. You want to feel better about yourself, something bothers you, that's why you do something about it. That's why you have body recontouring surgery. Okay, second, why do you have a specific surgeon do your surgery? Again, this isn't rocket science. You go to someone who has the experience, who has the same philosophy of that you do regarding whatever changes that you want to make about yourself. You go to someone who you feel comfortable with. If you go to a plastic surgeon's office and he dictates to you, he says, "Oh, here's what you need, little patient. You don't worry about it yourself. I will take care of everything that you want." But he doesn't listen to you. You have no connection. This is not going to work. He can be the best technical surgeon in the world, but it's not likely to have a good outcome if you don't have a personal connection with him. He's got to be able to listen to you and figure out what it is that you want to change about yourself, and then communicate to you whether he can do that or not. I should say he or she. Otherwise, it's just a one-way street, and you're not going to be satisfied. If they're not going to listen to you, you got to go somewhere else. And I always encourage people who come to my office. Often they've come from other doctors' offices. I have no problems with you getting a second opinion. I don't profess to have a monopoly on wisdom, but I'm pretty sure that if you come to my office and I have a discussion with me, if you're going to have the surgery, you're probably going to have it done with me, because I usually have an ability to connect with patients. Now, what are red flags for if you go to someone else about not having the surgery with them? If they can't show you before and after pictures, and quite a few before and after pictures, that should be a red flag. I mean, why can't they? If they are not a surgeon who really specializes in the operation that you're interested in, maybe this isn't the best person for you. If they can't explain how many operations of this type that they've done in the last 5 years or so, well, maybe not so much. If they can't tell you that they're the ones who are going to be taking care of you after surgery, if you have a question or a problem and you want to pick up the phone at 2 in the morning, who are you going to be speaking with? Are you going to be speaking with a nurse who doesn't know your case? Are you going to be speaking with a doctor who happens to be on call who doesn't know your case? Or are you going to be speaking with your surgeon? That's important. Who's holding the knife in the operating room? Is it your surgeon, or is it a assistant, or someone, a student learning, anything like that? These are important questions that you should be asking your surgeon. And again, do you connect with them? Is he or she listening to your concerns? Do you think they understand what you're trying to communicate to them? Are they able to tell you if this is something that is a good idea, or are you likely to achieve your goals? If not, now is probably a good time to seek out a second opinion. This is all I do, is body recontouring. I've been doing it for a very long time, and I'm happy to show a large volume of before and after photos of just about anything that you're interested in seeing. So it's very easy. Just make it call up our office for a free, no obligation consultation. You can chat with me. You look at the before and after pictures. We can discuss exactly what you're interested in accomplishing, and you can determine whether this would be a good fit for you. So hope you're enjoying the lovely autumn colors, and we will see you next week.